Over many years of working in multiple hospitals, treating thousands of patients, and having interacted with tons of patients and their family members and friends, I have on multiple occasions tried to understand and analyze why incidents of violence against doctors occur. Is the doctor treating you a friend or a foe? I'm Dr. Neeshma Reddy, consultant radiologist, Nikhil Hospitals. At a very fundamental level, if we analyze human relationships, all relationships that a person has during his whole lifetime can broadly be classified into two distinct categories. Whether a given person is a friend who is there to help you, or is he your foe who is not acting in the best of your interests. And the basis of every relationship is trust. The decision of whether the chosen treating doctor is trustworthy should be analyzed and decided within the first couple of interactions the patient's family has with the doctor. Also, a bit of background check about his past professional accomplishments might aid the family in coming to a conclusion. And once the decision is made that the treating doctor is on your team as a friend, then the next step is to analyze who the enemy is and against whom the battle is being fought. We need to understand that the real enemy is the disease. COVID-19 is also a disease, which happens to be very, very powerful and extremely unpredictable. As with every battle, we need to understand that the end result is not a foregone conclusion. The battle can be fought with the best of ammunition, but even then, the result cannot be predicted with certainty. Battle against COVID-19 is no different. The only way of improving our chances of winning a battle is to make sure that the whole team works together in the most efficient way possible. If there is an animosity brewing against the treating doctor, then the chances of the enemy winning the battle become extremely high. In this scenario, it would be in everyone's best interest that the patient transfer to another doctor and hospital. But because COVID-19 is so widespread, I would urge each one of you to please play out this process in your head and come to a conclusion of under which doctor you would want to admit your family member if at all the need arises. Next is the allegation on excessive billing and medical negligence. These two are not the same. If at all a dispute happens, please have a clear understanding of what the dispute is about and what is the way forward to resolve the dispute. If the dispute is regarding medical negligence, then violence and vandalism is absolutely not the answer. The best way forward would be to involve the relevant government authorities who will aid and help you in deciding if at all the medical negligence was the cause of death. Even the most notorious of murderers who have committed the most heinous of crimes are not convicted and hanged in public. Then why should a doctor be subjected to such treatment? To kill a patient, the doctor should have one, personal grudge, which is very unlikely, two, monetary gain, an impossible scenario considering the patient would have stayed longer in the hospital if he was alive. Three, does not know how to treat that particular disease. Again, very, very unlikely considering he or she would have been trained for close to 10 to 15 years in the best of Indian medical colleges and would have had multiple years of clinical experience of treating such patients. Above all, every doctor in India today understands that if a patient dies, then his whole professional career is in jeopardy, and no qualified doctor would take that risk of not treating and trying to save the patient to the best of their ability. A survey shows that 70% of doctors in India at some point in their career are victims of violence and vandalism. This statistic, according to me, is most alarming. Over the last couple of years, as COVID-19 continues to spring up fresh challenges every day, the only way of conquering these challenges and to come out victorious is to consider the medical fraternity in general and the treating doctor in particular as your friend. Thank you.